It is 8:50, and on a 15th day of June, halfway through the halfway month, we are talking with Marc Shellenberger. Marc Shellenberger is Comprehensive Mental Health. And Marc, good morning, and thank you so much for being here today. How are you?
Thank you, Dave. I'm doing well, thanks.
Excellent. Boy, oh boy, we have had a number of conversations over the last couple of months with folks from Comprehensive Mental Health. Is this an anniversary year for you guys? Is that
50th, yes.
Yeah, the big 50. Yeah. You don't look it at all.
I was 8 years old when Comprehensive started business, so...
Okay, so you're in the zone,
man. So they've been around for a long time.
Yeah. And what would you like us to know about the good folks at Comprehensive Healthcare, I guess is what it is now, right?
Yeah, Comprehensive Healthcare.
Let's give it its proper due, because you guys have grown, expanded, and what does the community need to know from Marc this morning?
I'm talking about a new program to Comprehensive Healthcare and something that's new to Central Washington, and that's our Hub and Spoke program.
Hub and Spoke,
yes.
Okay, that makes sense. I've heard of those.
Yeah, and this is, Hub and Spoke exists to help battle the opioid crisis in our nation today, and so we were awarded a SAMHSA grant from the Washington State Healthcare Authority in 2018 to start our own Hub and Spoke network in Central Washington and assemble a team and start the good work that we've been doing since 2018. And so our program and our network exists to connect people with opioid use disorder to a medication to treat that disease.
Now, let me ask you this.
Yes.
Where the numbers are skyrocketing, where would we be without this program? Or is this program not to full effectiveness yet, would you say?
I think that the program, I believe wholeheartedly that the program contributes to the health of our community rather than take away from it. And I'd really hate to see what our community would look like today without greater ease of access to medications to treat opioid use disorder. Regardless of an opinion or negative bias about medications, the fact of the matter is that it is considered a best practice in the treatment of that disorder, meaning it has the most or the highest potential to reduce the overdose and fatality from an overdose than any other.
And are we talking about a sort of a weaning thing and methadone-ish type of programs, or what are we talking about?
Methadone is one of 3 medications today that is FDA approved in the treatment of opioid use disorder. So it's been around forever. Since the late 1960s, it was authorized for the use of withdrawal management.
And Comprehensive Healthcare is now in more places, right? And thus, theoretically, the spokes reaching out to get this information available in more places?
So our network is just that, a network of community partners that are connected to people with opioid use disorder to assist them with the medically monitored startup of the medication to treat withdrawal and craving. Those are 2 symptoms of opioid use disorder that we know people struggle with the most.
Right.
I've tried to stop using, but I can't get through the withdrawal. And if I do get through the withdrawal, there's this ongoing obsession or craving.
That's all I can think about.
Yeah, right. And so even if I get through the withdrawal, it's going to be difficult for me to engage in more traditional forms of substance use disorder treatment, like residential or outpatient treatment, if I don't have the capacity for focus.
I certainly can't return to normal society and hold down a job and those kinds of things, right?
Absolutely. So it doesn't end there. We're not about getting people connected to a medication and say best of luck to you, because we know that doesn't work. I mean, medication is better than nothing, but I have a team of 5 counselors and substance use disorder professionals that provide outreach, engagement, and case management services to individuals. Once we develop a relationship and get them connected to a medication, a life-sustaining medication, our job is to connect them to other resources within our network that are necessary for them to sustain this in the long term. So oftentimes what we find is after a person is able to discontinue use of opioids, they're struggling with this incredible depression or anxiety. So we may find that a person has an undetected co-occurring mental health disorder that also needs to be addressed and treated as well.
Right.
So we can connect them to mental health services. Maybe a part of a person's depression or a symptom of depression is suicidality. That needs to be treated with a medication.
No kidding.
Both of these, substance use disorders and mental health disorders, are real medical emergencies. They are diseases based on the American model of health. And
can the average American understand this? If you've not had an opioid addiction, the grasp. I mean, a lot of people think, okay, you have a bummer of a life, you turn to drugs to escape. We get you off the drugs, we deal with your bummer of a life being everything's fine. They don't understand the more or less the rewiring of your body towards this addiction and everything that goes with that. Do you think the average person, I mean, in terms of finding empathy, sympathy, compassion, that's tough too sometimes when you see somebody going through the back window with your stereo because they got to afford to pay for the drugs that they simply have to have, or, you know, where are we at with that as a society?
I have to believe that that's getting better. I mean, that's a large part of my role as the team leader for the Hub and Spoke program is community education.
Yeah.
I mean, we know that a lot of bias against medications is due to ignorance. I mean, many of us, if we haven't been affected by it either personally or if we have friends or family members that have been affected by it, we don't understand it. You know, we may look at it as something very frustrating, a character defect, a lack of strength.
Right. Where's your backbone, buddy?
Yeah, it's not about that. You know, a substance use disorder is a chronically relapsing disease of the brain that needs to be treated with a medication. Opioid use disorder, that is, needs to be treated with a medication like any other disease that's chronic, or a person may die.
Well, all right, a couple of minutes we've got left. What do we need people to know as far as plugging into the resources that you folks have? If I know somebody that could use your help, or if I'm that person, what should we do?
Please visit our website at comphc.org. We pride ourselves on ease of access to our Hub and Spoke network, and a simple telephone call is the best and most responsive method of referral. And we can be reached at 509-317-2690.
How does the payment / insurance thing work there to make it workable? Because chances are you're talking about people without much in the way of resources at this point, right?
My team, my staff, their job titles are Spoke Care Navigators, and one of the things that they do is they help people navigate the insurance world. So if they need the help and they're willing to accept our help and they don't have insurance, then we help get them connected to insurance. And comprehensive health care also has what we call inpatient assisters that can also help people get connected to an insurance that will pay for the service that they are in need of. So that's another thing today that's different than 10 years ago, ease of access to insurance, or the ability to pay for necessary treatment services.
Okay, 30 seconds. We're out of time. Tell me this. Why are we seeing more and more people getting into opioids?
Well, I will say this. I mean, we saw the spike happen around March of 2020.
COVID-related?
COVID-related. So people were afraid. We were all afraid of the unknown. This was new territory for all of us, and so I think a lot of people isolated and used substances as a coping skill.
Yeah. Well, as often the case, coping, but it certainly helps you down the wrong road.